Thanks for joining us on the weekend edition of National Focus. I'm Mervin. Coming up, the Health Ministry reports significant progress in the delivery of healthcare services. Cabinet to consider introducing an HPV vaccine. And the Dominica Red Cross officially launches a hazard and first aid apps. Details of our headline stories and others after this.
Hello? Listen, you have to call me back because I'm going to cross the street. Okay, bye.
Be smart. Don't use cell phones while crossing the street. Be safe. Use the pedestrian crossing. A message brought to you by the Violence and Injury Surveillance System Committee in collaboration with the Pan American Health Organization.
Thank you for staying with us. The island's Honorable Health Minister, Dr. Kenneth Daru, has revealed that Cabinet will officially consider introducing an HPV vaccine to the infant vaccine regimen. HPV, or the human papilloma virus, is the name for a group of viruses which affects the skin and moist membranes lining the body. Some types of HPV can cause genital warts, a common sexually transmitted infection. HPV can also cause abnormal tissue growth, which can lead to cervical cancer.
Over the years, we've seen an increase in the incidence of cervical cancer in younger and younger women. So, as we speak, we've gotten a quote from PAHO, and of course, as I said, this has to be considered. The financial part of it has to be considered. We're getting at very concessionary rates, as Dr. Johnson hinted at earlier on. And pretty soon we should have a decision by the Cabinet, of course, Ministry of Finance Cabinet, as to whether or not we introduce HPV, the HPV vaccine, as part of our routine vaccination vaccine program.
GIS News will follow that story and bring you more information as soon as it becomes available. Top performing schools and teachers were awarded at the 9th Annual National Sports Awards, which convened on Thursday. At the ceremony held at the Fortune Hotel, the Portsmouth Secondary and the Roosevelt Douglas Primary were recognized at the top secondary and primary school respectively on the island for the year 2014. Also capturing awards for Physical Education Teachers of the Year were Henry Langley of the Salisbury Primary School and Cynthia Joseph of the Portsmouth Secondary. Addressing Wednesday's ceremony, the Honorable Minister for Sports and Youth, Justina Charles, says the Dominica Labour Party government continues to recognize and promote the importance of physical education in schools.
During the past year, we continue to strengthen our school sports program in an effort to ensure that all students within the primary school system were exposed to physical education. It is important to note that the school physical education programs are primarily responsible for promoting healthy lifestyle among the youth. Therefore, we continue to focus on attention at reaching every child through the primary school's physical education and sports program. We were able to achieve 100% coverage in 2014 through the National Employment Program, since we were able to increase the number of officers responsible for the delivery of physical education at the primary school.
The Honorable Minister added that it is incumbent on the national associations to strengthen and increase physical education activities beyond the classroom. According to the Honorable Charles, government is ensuring that fields and sporting facilities across the island are conducive for sporting activities. She highlighted a few of government's endeavors.
During the last year, work continued on the Grand Fond playing field, which is now 95% complete. Several other playing fields received attention, such as the La Plaine playing field, Petit Savan, and Woodford Hill. The intention is to have these facilities completed during this year. Work is ongoing at the Soufriere playing field. In March of this year, we had a visit by a group from a lighting company out of Barbados. This group visited 22 playing fields across Dominica to carry out studies in order to determine the possibility of lighting these fields, which includes the Lindo Park in Goodwill. The intention is to install special solar lights at these fields using available technology.
This, the Honorable Minister says, will create greater opportunities for citizens to participate in sporting activities. Also in attendance at the 9th Annual Sports Awards was Dominica's President, His Excellency Charles Savre and Mrs. Savre, the nation's Prime Minister, Honorable Roosevelt Skerrit, and other government officials. At this time, GIS News wishes to apologize and amend an inaccuracy in last evening's newscast. The top Association of the Year award went to the Dominica Football Association and not the Dominica Cricket Association. The International Red Cross and Red Crescent movement is celebrating and reaffirming the relevance of its fundamental principles: humanity, impartiality, neutrality, independence, voluntary service, unity, and universality. Each year, on May 8th, 189 national societies which currently exist across the globe observe this day in honor of the founder of the Red Cross movement, Henry Dunant. In commemoration of this day, the Dominica Red Cross has officially launched 2 apps for iOS and Android, a multi-hazard app and a first aid app.
These apps are available for smartphones, Android phones, which can be downloaded free of charge. And they are a means of sharing knowledge about the hazards which commonly affect Dominica and what actions can be taken to prepare for and respond. The app also includes some tools like a flashlight, a strobe light, an alarm, and emergency messages which can be sent out to friends and family post-disaster to say, I'm safe, really. It also is a means of testing your knowledge about the hazards which affect us. And if you don't have that knowledge, it provides that information. So it really is a training tool as well.
She says the first aid app, though it does not replace a certified first aid course, provides information on injuries and illnesses and what response should be taken during these events. Bernie is confident that the apps will significantly improve first aid response performed by everyday nationals.
Not everyone has been through a formal first aid course or indeed a disaster risk management training. So this does provide a lot of information in summary form, and it allows, if something happens, let's say whilst you're traveling or you're in the office out in the field, and you're not sure exactly what assistance to provide, you have a quick means of checking to find out what is the right first aid you should provide. So, it's going to be very useful for those who download it.
These apps were developed by the American Red Cross Society and customized to suit Caribbean countries. According to the director, proper first response means the difference between life and death.
Very often when there is an accident, bystanders will just look on without providing assistance. If you're trained and you know what to do, that first aid that is provided is invaluable in ensuring that the right treatment is provided, ensuring that unless somebody is critically injured and must be moved immediately, that you can take measures to treat them on site and wait until they can be moved in the correct manner with when an ambulance arrives with equipment. Because sometimes the practice of just picking up individuals from the road, pulling them out of a vehicle and putting them into the next passing car can do more harm than good. And very often there is no necessity to move them immediately. And this is where triaging on site comes into play, and this is what is taught through mass casualty management training.
These apps are available on the Apple Store and freesidedcube.com. You can also find out more on the Dominica Red Cross Facebook page, Dominica Red Cross Society 767, and our GIS News website from Monday, May 11th. You're watching National Focus. Still to come, Ministry of Health makes major progress in the delivery of healthcare services. Stay with us.
Did you know the Caribbean Court of Justice is 2 courts in 1? The CCJ has 2 functions: an original jurisdiction, which deals with your right to move between CARICOM countries freely and your right to move your money and your business. This is the basis of the CARICOM Single Market and Economy, CSME, and the revised Treaty of Chaguaramas, and an appellate jurisdiction to hear appeals from courts of those countries which decide to use it as their final court of appeal and no longer go to the Privy Council. All CARICOM member states who have signed the agreement establishing the CCJ are members of the CCJ.
Welcome back. The Permanent Secretary in the Ministry of Health, Helen Roye, is reporting that her ministry has made significant progress in the improvement and delivery of healthcare services. At a press conference on Wednesday, Roye detailed the capacity-building successes of the Ministry of Health.
We were able throughout the last few years to have sent 7 persons, medical doctors, to qualify in various specialties. Actually, we have had 2 of them returned. We have had an internist who has returned and has been providing significant assistance to the medical wards and dialysis unit. Just the end of April, we have one of the doctors who went to study infection epidemiology. She is back, and we're expecting to benefit from her services. We still have the oncologist on training, another internist, and an orthopedic surgeon. We have also been able, as you would have realized lately, for the past 4 or 5 years, we had a shortage in community health nurses. We have been able to send 4 of these category of nurses to be trained. 2 of them have returned. We have also sent 3 family nurse practitioners, and 2 of them are back on island. So this is indeed an achievement for us.
In addition to more trained staff, the Ministry of Health is also paying attention to the policies that guide the delivery of healthcare.
We realize that critical to maybe ensuring that we give quality care is to have a framework to provide this care. And of such, we have placed great emphasis on development of policies where we did not have policies before. So we now have draft policies in pharmaceutical care, in dental health, in chronic non-communicable diseases. We just recently launched our infection control manual. We have a draft in HIV policy, and we have also worked together with the Nutrition Council and just got approved and minister. We just had our nutrition policy for Dominica, our national policy has been approved. We have completed the nutrition and school health policy, and we're just waiting to pass it through to cabinet for approval. So these are some of the areas of our achievement.
The D-Medis program, which was piloted in the Granby Health Center and the Princess Margaret Hospital Accident and Emergency Department in July last year, is also being counted as an achievement.
In the next few months, we intend to pilot it in the other areas like the lab and the different health centers, where persons will be able to access their information almost immediately. So if you were seen at PMH, we could get your records from the district. If you were in the district and the nurse wants to get some information, medical information, they would be able to get that.
On top of all of this, new equipment is making for a better patient experience at the PMH. The new mammogram, CT scan, gastroscopy and laparoscopy machines have been installed and are working well. The Permanent Secretary added that a new MOU signed with the government of Turkey will mean new equipment for the Portsmouth Hospital. The Ministry of Health and Environment is reporting that the Dominica Police Force has been consistent over the years with the amount of seizures of the illegal drug cannabis and has even increased in the amount of seizures of the illegal drug cocaine.
We've seen that from 2010 to 2014, basically there hasn't been really a change in the amount of cannabis being seized, except for 2012, where you see a vast decline in the amount of cannabis trees. We also saw that from 2010 to 2014, there was a dramatic or a vast increase in the number of seizures of cocaine. All right? So it moved from 100 kilograms to 213 kilograms in 2014.
This statement came from Research and Information Officer at the National Drug Prevention Unit, Martha Jarvis, during a presentation of substance-related statistics. These statistics were reviewed at a national consultation for the drafting of a strategic plan for alcohol and other abuse prevention in Dominica held last week. The Research and Information Officer also revealed that statistics show that there have been no health-threatening incidents in Dominica involving designer drugs.
The supply of cocaine comes from South American producers, and something we've been seeing on other islands, and it has not been recorded by the police, just mentioning that designer drugs like amphetamines and ecstasies are not recorded. Okay, so we have not had any seizures or reports of these drugs. Although sometimes we will talk to students in the schools and they will talk about the use of ecstasy, but it's not something that we see from supply reduction.
Jarvis notes, however, that there is still more to be done to reduce the impact of drug abuse in Dominica.
We see that marijuana and cocaine are the two main drugs being seized by the police with supply reduction. Supply statistics are available from many sources, and there is a need to screen for quality and consistency. Consumption statistics surveys like the GIS, that is the Global Youth Tobacco Survey, the National Secondary School Drug Survey, needs to be done at least every 2 to 3 years if we are to scientifically identify trends.
According to the Center for Disease Control and Prevention, childhood obesity has more than doubled in children and quadrupled in adolescents in the past 30 years. Obesity can be defined as having excessive body fat and can lead to immediate and long-term effects on health and well-being. It is in response to this that Dr. Lenora Fevrier-Drago is encouraging the nation's youth to take a stand against obesity, stating that obesity can be reversed.
The interesting thing is that when you speak of obesity, it's not one of those things that's extremely hard to undo, unlike damage that's already been done to your pancreas, which will cause you to have diabetes, or damage that's been done to your heart and your blood vessels, which sometimes is irreversible. Obesity, even the slightest change in your weight, can improve your chances of being healthy again. So lifestyle changes is extremely important.
Dr. Fevrier-Drago was addressing the DSC's annual health fair last month and assured students that breaking the familiar trend of obesity and other non-communicable diseases is possible.
So it's not okay to say, well, my grandfather had it, my mother had it, so it's okay, man, if I have high blood pressure, I'll just take the pills that are necessary. So your mother might have had it, your grandfather, and all the way down your generation. However, if your lifestyle is in check and you decide to live properly, to eat properly, to exercise, to eat what comes out of the soil and not out of the machine, then your chances of developing obesity, high cholesterol, high blood pressure, diabetes are greatly reduced, and then you live a healthy life. So you actually break the trend, the familial trend of having all of those diseases.
Obesity is most commonly measured by the body mass index, which is used to estimate the classes of obesity.
You will find that when they look at the chart, if you're below 18.5 on the BMI scale, you will seem underweight. And if you're 40 and higher, you go into extreme obesity. So we have different classes of obesity. You go for your normal, underweight person, your normal weight, overweight. So you might just be slightly there. If you go this way, you're overweight and obese, class 1. Then you have obese class 2, which falls between 35 and 39.9. So you will see the chart for yourselves, and you will see exactly where you fall on that chart. And there's obesity class 3, which is 40 and higher. And it's that red, bright red square heading that direction that you cannot find a number for it. And that's where we find a lot of our young people are falling.
In young people, obesity is most commonly caused by inactivity, lack of sleep, and unhealthy foods. However, according to Dr. Favre Drago, a change can be made to reduce the risk of obesity through lifestyle changes.
We have control over what we put in our bodies and what we put in our mouths. So instead of the bakes and all of those very tasty things, because trust me, they look good, they smell good, anything with butter and oil will taste good. But is it good for you? No. Anything that's done outside of moderation. So I'm not saying do it a bakes and cheese, you grab it and you're on the go, but it shouldn't be your everyday snack. Sooner or later, you need to go to one of the supermarkets, buy some grapes, buy some apples, and carry that along. A granola bar. And be vigilant in what we put into our bodies, because like I said before, some of the damage that is done to our arteries, we spoke about cholesterol, we spoke about plaque formation, and strokes, and high blood pressure, and all of those things. It's not to scare you, because the reality of it is that we're finding less and less elderly people coming down sick, and more of our young persons now being placed on medication because of these non-communicable diseases.
And that's the English news. McPherson St. Luce is next with the Creole highlights.
Mommy, let's cross the road. Come on, Mommy.
Come back to us. Yeah. Listen, honey, don't ever be too busy to cross the street. Take your time. Look for the pedestrian crossing and ensure that no vehicle is coming. Then you can cross. Do you understand?
Yes, Mommy.
Good. Stop. Let's look.
Be smart. Don't be too busy to get across. Look before crossing. A message brought to you by the Violence and Injury Surveillance System Committee in collaboration with the Pan American Health Organization.
Allô tout le monde, bienvenue à cette nouvelle en créole, non moins c'est McPherson St. Luce. Premièrement, compagnie Airtel qui a joué un pas autant significant en affaires technologie. Parole là sorti du ministre des Telecoms, Honorable Kelva Darrow, qu'on compagnie là célèbre 15 anniversaire à yo à le 4 mai l'année 2015.
Airtel a un important rôle. Plus si nous parlons Airtel, si service provider, vous savez faire ça vous voulez. Et puis, ça n'est pas bon pour le secteur là. Nous pour faire le secteur là important pour ces customers. Et puis, ça nous a fait, c'est nous a réguler le secteur là. Plus si nous un service provider qui a venu et puis qui fait un gros price pour plus l'argent là. Mon pour mener section. So Airtel là pour vendre ces monde là, ces customers là. For meeting regulations, so it's a service provider. You can keep you a check. So hot Dominic, nous service providers, nous plus service providers, nous Digicel, nous Lime, nous Wikibully, et puis nous pour ensure your service provider ça là, you a check, et puis you can buy customers on board service pour l'argent yo. Which is important. Si vous êtes un customer, et vous pas qu'à taper board service. Ou pour manual check, ça m'a payé pour. So, Airtel a une responsibility pour customers et pour ensure que les service providers remain en check.
En nouvelles affaires Bush Fires, ça c'est des faits qui a pris tout partout, ces bagailles qui a concerné le département pompier autant et spécialement qu'on nous en saison quand même. Parole celle-là sorti du chef département pompier, M. Josiah Dupi.
Yon bite moi voulais parler contre c'est diffé moun ka mette et en particulièrement nous ka voir ça assez on the west coast Dieu blanc Bioche qu'on nous ka naviguer Portsmouth pour ozo ou ka voir ça et ça a affecté habitat à ces West Coast là nous ka brûler bois qui a amené fleurs qui très important pour miel et enfin il y a monde qui a femme miel et ça a enfin yo j'ai reporté qui autant niche miel yo j'ai perdu ça comme ça c'est un bitin qui est anti concern pour nous et nous avons demandé mon public là si vous connaissez un monde qui a fait ça c'est faut dire arrêter parce que il pas qu'à des belles là ouvre tout partout nous et aussi ou ka damager habitat pas ou ka damager niche miel à ces monde là qui a fait c'est yo ka fait ça pour un living.
Monsieur Dupin manque à courir à ce public là pour porter attention et puis situation là.
Nous avons demandé pour porter attention, mais nous allons continuer à faire ça nous paye et moi je contact à passer département d'y fait même obligé de développer j'écris qui nous avons voir à présent et moi j'ai autant confiance dans ça nous avons fait à présent et ça moi savent nous que continuer à faire in the future.
À la nouvelle, Dominica bénéficie selon Memorandum of Understanding, ça c'est un agrément qui est foncé en secteur santé. Parole celle-là sur le permanent secrétaire ministre santé Helen Royer.
Et puis maintenant aussi nous avons même qualité agrément là actuellement comment dire un premier session là nous tenir là nous taper des noces nous juste dimanche yo quitter yo aller matnik et puis nous savons ICU sont important compagnon l'hôpital là et puis ça c'est pour dire les puis monde qui bien malade et puis nous taper des monde pour aller train et puis nous expect qui d'autres monde qui aller train et puis nous qui taper d'autres monde venir Dominique tout et puis nous déjà voyons progrès depuis nous commencer petit agrément là nous déjà voyons progrès et puis gam yo ka dit et puis nous semaine là ça des monde qui calé MRI et puis nous ka taper on reduction à prix la monde qui paye because of agreement ça.
Oui, ka fait report nos Dominique qui ka taper twinnement en Martinique. Finalement premier ministre Honorable Roosevelt Skirt qui était payé jeudi vendredi pour attendre le Caribbean Friends Summit qui a pris place à Fort-de-France Martinique. Summit ça c'est préparation pour 21e session Convention Nations Unies qui concerne le changement climatique. Président François Hollande, c'est chairman meeting aujourd'hui. Premier ministre Skerrit qui est aussi chairman OICS qui a adressé meeting là ensemble et puis président Hollande, président conseil régional Martinique His Excellency Serge Le Chairman, chairman CARICOM, premier ministre Perry Christie, Hot Bahamas, et puis secrétaire général association l'État Caraïbes, His Excellency Alfonso Munera, premier ministre Skerrit, qui est chef en discussion à ce sujet développement sustainable et puis énergie renouvelable. Premier ministre Skerrit aussi qui tient discussion et puis président Hollande. Premier ministre Skerrit qui a aussi attendu des cérémonies qui concernent l'État esclavage qui vont prendre place en Pointe-à-Pitre, Guadeloupe, dimanche qui vient. Ministre qui a une responsabilité pour faire planning, Honorable Dr. John Colin McIntyre, qui a une position comme premier ministre. Messieurs, mesdames, ça c'est tout pour nouvelles en créole pour à présent. Non, moi c'est McPherson Luce. Ni un bon week-end et pour toute maman, ni un bon fête maman. Au revoir.
Coming up next, your tip of the day.
Wash your hands. I am Adora Tuse, health educator from the Ministry of Health. Proper hand washing protects against the spread of many common illnesses and germs. Wash your hands often with soap and water, or you may use a hand sanitizer. Remember, clean hands save lives. Protect yourself.
A message from the Health Promotion of the Ministry of Health.
Today we bring you a few road safety tips. Tip 1. Get in the habit of conducting periodic safety checks to make sure your vehicle is in good operating condition. Read your owner's manual to clearly understand which dash lights or signals indicate your vehicle is not operating properly and what to do in such situation. And tip 3, program your cell phone with emergency numbers and keep a backup written in your glove compartment. And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website at news.gov.dm. Like our Facebook page, facebook.com/GIS News Dominica, and follow us on Twitter at GIS Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. From all of us here on the GIS News production team, I'm Mervin. Thanks for watching and have a great weekend.